Let's get healthy on a Thursday with some advice about flu season. You know, it's a common question for parents. Your kid comes home coughing, sneezing all over the place. So is it the start of the flu or just a basic cold? Joining us with some of the signs to watch for, Dr. Joshua Russell with Legacy Go Health Urgent Care. Welcome this afternoon. Thanks for being here.
Great to be here.
So can you kind of talk about some of the basic difference for parents who might not know how to spot that immediate difference between the flu and the cold?
Sure. Well, I'll say in children it is a little bit more challenging because kids tend to get fevers very easily with almost any illness. So flu and the cold are caused by viral infections, and both can cause fevers. Although as children get older, the likelihood of having a fever with an illness goes down. So if your child's in school, a school age, and they're having a fever, it's much more likely it's the flu. One of the major differentiators, both in children and adults, if the child's old enough to communicate this, is severe body aches. So if you haven't had the flu, it's pretty apparent, or if you have had the flu, I should say, it's pretty apparent when you have the flu that you just ache and have pain all over in all of your muscles. And that really distinguishes the flu quite reliably in adults and in children too, if they can communicate that.
That panics me as a parent when the child does say they're achy, because you hear about meningitis, particularly if they say the neck or so.
Oh my gosh, how many nights have you gotten up and looked for the spots? Yeah. Right? You push their skin, oh, okay, still. I mean,
So
it
is that a
worrisome.
sign you should go to the doctor, the fever and the aches?
No, well, so I would say that I would recommend if you're in the age range of 5 to 65, that it's actually my recommendation that unless you're having symptoms outside of a basic flu, that you would stay home, because the way that we run into these epidemics is that people spread the virus in the community. And so when you don't stay home from school, from work, and you come in coughing, sneezing, and touching things, that's how other people at school and in the office get sick.
But the problem is this year, we're worried because we keep hearing about people dying from the flu.
And children dying.
Exactly.
specifically, yeah.
Sure. Well, take a deep breath.
Okay.
There's been 10 children who've died nationwide, which is a obvious tragedy, but it's still something that the vast majority of people, even if they do get the flu, will have a limited course where they will recover on their own just by resting, staying hydrated, things of that
So it's
nature.
not worse this year?
There's definitely more cases of flu,
Okay.
and it is a more serious strain of flu. The strain of flu changes from year to year. So I would say that the typical symptoms of flu are headaches, muscle aches, cough, sneezing, runny nose, sore throat. If you have those symptoms but you're breathing okay, or your child seems to be breathing okay, not listless, not with no energy, not seeming like they're not getting enough air, then it's okay to just usually watch the symptoms at home. But if they do seem to have these deviations from those normal set of flu symptoms, it is a good idea to come in and get checked out. And I will say, if you haven't had your flu vaccine, although it's not the most effective flu vaccine we've ever had, if you do get it, even at this stage, it will likely lessen the severity of the flu and reduce the likelihood of you needing to be hospitalized or your loved one needing to be hospitalized.
I do need to ask, though, when you do hear of a child dying of the flu, is it the flu itself or the complications such as pneumonia?
Sure.
Or what is taking the lives?
Great question. Yeah, it can be both. There is an exaggerated immune response in younger people to any type of infection, and sometimes that immune response can be so severe that it causes their organs to shut down, and then you might have heard multi-organ failure and things of that nature. But as you alluded to, pneumonia is a common, or one of the more common serious complications of influenza. So that's why I emphasize that evaluating the child's breathing is probably the most important thing that you can do. Okay. And for children under 5, it's good to be prudent, and if you're uncertain, err on the side of getting the child checked out.
If you think you're let's say you have a couple children and you think one might have the flu before you can get them into the doctor, I mean, do you really just try to isolate everyone? What can you do? Wear masks at home?
Sure, yeah, I mean, it's not the most fashionable thing in this corner of the world, but it's common practice in other parts of the world for people to travel, go outside the house wearing masks, and when we have a patient in the emergency department that is a confirmed case of flu, or even we're testing them in suspected case of flu, what we'll do is wear masks in the room and have the patient wear a mask too. They're effective at catching those respiratory droplets, which is how flu is spread.
Okay.
A final question, the fever. 103 and higher, I should be concerned, or when do you get really scared?
Or do we even treat it? I've had doctors say, don't worry about it.
Sure. The short answer is there's no level of a fever that is particularly dangerous or indicative of flu or not the flu. And the most important thing for children is to watch how they're behaving. And if they're behaving normally, there is evidence to suggest that not treating the flu is actually going to maybe help them get better, because a fever is our body's way of responding to an infection.
Getting rid of the bad
yeah,
stuff.
exactly.
Yeah.
And that's really how flu improves and goes away, is that our body fights it off on its own. And that's what happens the vast majority of the time. But if you have not gotten your flu shot, it's still worth getting. And if you do have symptoms of the flu and you don't have chronic diseases or respiratory symptoms, difficulty breathing, best to stay home and just keep it from the community.
All right, Dr. Joshua Russell with Legacy Go Health, thank you very much for the
Thank you.
information.
Yeah.